Throughout the COVID narrative, we have seen that the measures imposed indiscriminately on the general public have disproportionately harmed the development of children. And that trend continues still, as evidenced by the overwhelming hospitalization rates seen across North America at various children's hospitals. Tamara Ugolini with Rebel News, highlighting the absolutely disgraceful handling of COVID-19 that continues to negatively affect the health and development of our future, our children. At the Hospital for Sick Kids in Toronto, Ontario, which is one of Canada's largest and most prestigious children's teaching hospitals, they're reporting a record number of children coming to the emergency department with non-COVID related respiratory illness. In a statement provided to CP24 by Sick Kids, they said that they typically plan for 220 to 230 patients at the emergency department per day. As per conflict of interest riddled and COVID zero dogmatist David Fisman, who went so far as to petition the federal government to lock Canadians down even harder, well, he alleged on Twitter that he had an anonymous colleague tip him off that there were 300 kids in the pediatric ER at Sick Kids on October 26th. Fisman has also been a clear leader in misinformation by pushing inaccurate and faulty modeling predictions, including a study that essentially advocated for the segregation of vaccinated and unvaccinated populations. So I take what he has to say with a grain of salt. But what he says is not an anomaly. All over North America, children's hospitals are seeing an alarming increase in respiratory illness in children. It's almost as though the vaccine pushers who ignore Pfizer's own trial data, which showed an alarming increase in illness and death post-COVID-19 injection compared to the placebo group, thought that a revolving door of ineffective and harmful injections was a good idea. Especially when ample real-world evidence is reinforcing what actual experts have been saying all along, that natural immunity is far superior than artificial vaccine-induced immunity, like the study from the New England Journal of Medicine that found that children injected with COVID-19 shots actually had their natural immunity destroyed, while their unvaccinated counterparts held on to their robust natural immunity for exponentially longer. It's almost as though these poor children who have had their immune systems bubble wrapped by the unfounded fears of adults suffering from severe hypochondria for the better part of 2 full years are now suffering the devastating and potentially long-lasting effects of not having consistent real-life boosters. And I say boosters as in having those regular natural boosts to their immune systems found by way of simply interacting in and with everyday society. And perhaps masking, which has been proven to have negative psychological effects on children, is to blame for not only hindering their emotional and cognitive development, but may also have devastating effects on the respiratory health of those rebreathing their own water vapor, carbon dioxide, and other chemical compositions found in exhaled breath. To add insult to injury, the Hospital for Sick Kids is still riddled with staffing shortages seen in September and early October of last year. That's the same time that hospitals across Canada decided to broadly enforce vaccine mandate policies that did not allow for accommodations or exemptions, and they fired, terminated, or otherwise put on leave healthy and willing to work staff. The news article concludes with the idea that children who are contracting these respiratory illnesses were previously shielded by COVID-19 health restrictions and are now exposed to it for the first time. But again, this isn't related to COVID-19. And did the health restrictions really shield these children, or did this shield create a larger problem that we are only beginning to see the fallout of? For Rebel News, I'm Tamara Ugolini. As we learn more about how devastating the COVID response truly was, don't forget that certain institutions are still enforcing vaccine passports and even vaccine booster mandates. To check out our coverage and help support active ongoing litigation, head on over to the special website at noforcedboosters.com and chip in there if you're able to. That website again is noforcedboosters.com.